Kia ora, I'm David Downs. When we think about CAR T-cell therapy, this revolutionary targeted immunotherapy that can save lives, like mine, from cancers, it's going to take a lot of help to get there. We need the funding to make it happen. And I'm here at the Malaghan Institute to talk to some of the experts about why we need to go out to other people to ask them for help.
$15 to $20 million is what it costs to run a phase 2 trial, and that's a lot of money for us to try and find. So Malaghan Institute is an independent medical research institute, but we're also a charity, and so we need to basically be able to fund ourselves in order to do a lot of this medical research.
Revenue streams such as commercial investments, government funds, or payments from trial patients themselves are not viable options.
Clinical trials are really hard and they aren't typically funded by government. So we would get funding to do some of our basic science through government grants, but the government doesn't typically fund clinical trials. And I think the rationale for that originally was that a clinical trial would be a commercial type of activity and that a company would come along and fund it. But unfortunately, companies now require clinical data in order to make an investment or to make a partnership with somebody like us. So in this case, nobody is paying for the clinical trial. Government won't pay for it and the commercial companies require it, so we have to find the money ourselves.
So in New Zealand, we don't charge patients anything to take part in clinical trials. The costs have to be borne by us, the Malaghan Institute, as we try and make this CAR T-cell therapy for them. Both the cost of making the CAR T-cell therapy, but also, importantly, the cost of running the trial and gathering all the data from the trial in a way that could be acceptable to New Zealand and international regulators.
The funds that we raise are going to be used to run this whole trial, and that includes both the manufacture of the product as well as the trial itself. So that patient recruitment, patient treatment, patient monitoring, data collection, analysis, the whole thing.
We as an institute have taken some big risks in trying to develop this new kind of treatment, set it up here, build the facilities, the expertise, the infrastructure that allow us to take CAR T-cell treatments and new CAR T-cell treatments at that into the clinic, and not just have that research taken offshore and find that we do that work but it never becomes funded or available here.
So the cost of running a clinical trial is pretty huge. $15 to $20 million is what we need. And we're going out looking for support for this. As you've heard, it's not about getting government support, that won't happen. And the Institute, which is a charity, needs to raise that money themselves. And they need to do that with the help of New Zealanders, people who can see a future for innovation in healthcare in New Zealand. So if you're in a position to help, please do so.